There it goes. So Amanda, if you want to go to the next slide, just a couple extra little housekeeping things for our Zoom guests, especially while we do introductions. We would welcome cameras if you're comfortable to do so. Once again, just watching your microphone during any presentations that we may have. For our in-person guests, the women's restroom is just to the right, and we have found now that our men's restroom is to the right and then turn the corner and go down a little extra hallway there. We found that out. Next slide, we will have our agenda here. So we're going to have a couple updates and an overview of MKE Elevate real quick, just to make sure everyone's on the same page. We have the draft goals that came out of our February meeting. After that, we are going to start brainstorming strategies, interventions, partners, all that kind of stuff, with a little time for us to come back, because we'll have the Zoom group. You guys will talk amongst yourselves. In person, we'll talk amongst ourselves, and then we'll all report back anything interesting. We will have a little bit of an update on that implementation partner agreement, just so everyone kind of knows what the situation will be there. And then we'll wrap it up with some next steps. And so again, our big goals are confirming the language for the maternal child health goals, and then start discussing those strategies, objectives, what we want to be doing.
That they are not.
So as a little bit of introductions, we will do our name, the job role, and the organization that you're representing. I know many of us wear many hats. And then one thing you're looking forward to now that the weather is finally warmer, though inconsistently warmer. There we go. So I figure I can start with this one. I should surely introduce myself. I've gone half a meeting before ever introducing myself. So, and then we'll maybe just go around the table in the room here, and then we'll pop it over to the Zoom folks to introduce yourselves. So again, my name is Melissa Seidel. I am a health strategist with the Milwaukee Health Department, focusing on maternal and child health. And something I am looking forward to is riding my e-bike to and from work, not here because 27th Street is scary, but when I work from the UWM building, it's a nice, easy ride now that it's not so cold and windy. So I will pass it to my side here.
Hi, everyone. My name is Akinel Talsma. I'm a Associate Professor, College of Nursing, UWM. Excited to be here in person, as well as just getting us all together. I'm looking forward to Memorial Day weekend to catch some nice weather and have a little break. So
I'm going to pause this real quick. For the Zoom folks, we're going to try our nice little in the room microphone here. So hopefully you can hear all the folks down there.
Are you hearing us now? Okay, cool. Just making sure.
Yep, we are.
Okay. Hi, I'm Cameron. I'm a home visitor with the City of Milwaukee's Health Department in the EFM program. And something I'm excited to say, like, running outside is going to be a lot nicer now.
Hello, everyone. My name is Krista Turka. I'm a population health lead nurse by background for iCare Health Plan, which is a Medicaid Medicare plan. I'm excited to be here, excited to just go outside and not wear sweaters and be freezing every time I walk outside the door, looking forward to warm. So glad to be here.
My name is Dorian James, and with Breathe Easy Milwaukee, we had a grant to do asthma management for pregnant individuals and children from the ages of 2 to 18. And the one thing that I'm looking forward to with the warm weather is getting to Six Flags and riding the roller coaster.
good for you.
You can only do coasters in the summer.
I'm Andrew Galashewski. I'm actually a Mount Mary dietetics student, and I'm just excited to be able to go outside.
You're good.
And I'm Yvonne Greer. I have to get my speech together. I am now a new DRPH in public health. A registered dietitian, certified in the state of Wisconsin, and have an own private practice business. Why Eat Right nutritional consultant for healthy living. But also I represent MKE, the Milwaukee County Organization Promoting Prevention.
Quería que me pongan pierna, ¿verdad?
The Kids Initiative that we are really looking at, focus on child health equity. And then also I am part of the Nurturing Collaborative. And I will leave up to my counterpart to tell more about the Nurturing Collaborative. But I am definitely happy to be here.
I'm Allison Chavez Stewart. I'm the bilingual director of community relations for Planned Parenthood of Wisconsin, and I am planting my first garden Memorial Day weekend, so I'm very excited about some warm weather.
I'm Christine Alstrup, and I work at Meta House. Meta House, if you don't know, the substance use disorder treatment for women and takes priority admissions for pregnant and postpartum women. Also, we take children into our residential care up to age 12, so moms can stay with their kids often. And one thing I'm looking forward to, just not having to wear so many clothes and that kind of freer feeling, and sandals.
I gotta go in the camera. All right. I'm Gina Holt, assistant professor, UWM College of Nursing. I'm also a family nurse practitioner, and I'm looking forward to paddleboarding.
Oh, nice.
And hi, everyone. I'm the man behind the curtain. Hi, I'm Amanda Richmond. I am a public health strategist with the health department, focused on the built environment, and I lead our built environment action team. And I'm here to help out with the tech. So if there are any problems, alert me.
But I'm not sure. Do you want to stop the screen share for the Zoom folks to be able to see each other? Yes. All right, Zoom folks, Amanda, why don't you start and popcorn it to something? So if you're on Zoom, once you wrap up, pick someone else on the screen to go next.
I'm popcorning. Oh, sorry. I missed that. How about Katie? Katie Murphy.
Hi, everybody. Yes, I am Katie Murphy. I am a registered dietitian, and I oversee the WIC program here at 16th Street Community Health Centers. So I kind of come here with a dual lens because my background is in the WIC program, but I also oversee our parenting program here at 16th Street. So we do parental education, car seat safety, and things of that nature. So all things focused on little ones and parents. What am I looking forward to? Speaking of little ones, so my son is a little over a year and a half, and he always wants to be outside all the time. And so we have started to try to visit like every cool playground in the county, and we have quite the list. So we're working our way through that list with him, and it's fun. So we'll keep that up. Let's see. I'm glad I get to go first. This makes it easy. Otherwise, we start to lose track. Okay, let's give it to Tracy.
Hi, everyone. I'm Tracy Stanislawski. I work for Vision Forward Association in Milwaukee, which is an organization that serves individuals from birth all the way to the end of life with vision loss. My role is early education manager, and so I specifically work with families who have children, of course, with vision loss in the birth to 3 program, so 0 to 3, and then our preschool programs, which is 3 to about 6 years old, and then helping with them transition off to public school or wherever their next adventure leads them. But our main focus is working with the vision loss and how to really advocate for our children and families with vision loss. And I will choose see, Heather Champagne.
Hi, everyone. My name is Heather Champagne. I am a nurse by trade. I've been a nurse for about 12 years. I saw Chris, she introduced herself back there. Hey, Chris, we used to work together. And I work right now as a public health nurse for the North Shore Health Department. I also have my master's in public health, so trying to get in more into that realm as well. I'm not necessarily here even in that role, but I live in the city of Milwaukee, and maternal child health is just really important to me. So that's really, as a community member, why I wanted to be a part of this team. Something I'm looking forward to, everything everybody else said. I have 2 little girls, so being outside, but this weekend in particular, we're doing just a very short road trip, my husband and I, to meet up with some friends and hike the Red River Gorge in Kentucky. I'm not an outdoorsy person, so I'm not sure, I might just relax and let them go hiking, but it'll be nice to just do something different. And I will popcorn it to Erica Olivier.
Thank you. And yes, I'm not an outdoorsy person either, so good luck to them. I'm Erica Olivier. I'm the Deputy Commissioner of Community Health here with the City of Milwaukee Health Department. Oversee a lot of stuff. Generally, our maternal child health related programs, fatherhood programs, so doulas, WIC, home visitors, oh goodness, healthcare access, you name it. So, and also support some of the operational needs. And I'm one of the 4 deputy positions under the Commissioner of Health. So happy to be here. And what do I look forward to is brunch outside, patios. I need this kind of energy in my life again. So that is what I'm looking forward to. I will pass it to Brittany Roberson.
Hi, everybody. I am Brittany Roberson. I work for Fredericton Medical College of Wisconsin Health Network as a community engagement coordinator. So there is a lot of things that fall under my umbrella. So a lot of our reporting for the hospital entirely falls under me, but a lot of the work that I do is getting out into the community, making sure like they know that Freighter has resources to offer, making sure people get in, being able to like troubleshoot some problems, not all of them. And so one of the things that let me correct myself. The thing I am most excited about with this warm weather is we are getting really close to July. And I will tell y'all about last year, I started a savings fund just for Beyonce. And so I'm going to a Beyonce concert this year. So that is what I'm most excited about. Okay, so let me see, popcorning, I'm still at the beginning kind of. So I'm gonna go with Trina Ward.
Hi, thank you. I'm Trina Solm Ward. I'm an associate professor of social work at University of Wisconsin-Milwaukee. And my research area is infant and maternal health. So very excited to be here. I am looking forward to gardening and hiking with the warmer weather. And I'm gonna popcorn it over to Vanessa Johnson. Okay, so how about Alice Muehlbauer?
Thanks, Trina. Hi, everyone. My name is Alice Miller. I work at Freighter Hospital. I'm the administrative coordinator for guest relations and patient logistics. This topic in itself has nothing to do specifically with my role directly, but I do have interest in the area of maternal health and have published a couple papers on maternal health and social determinants of health. And for this warm weather, for me, warm weather means school letting out, which I am looking forward to because that means less schedules to, try and work into my own schedule. So for me, it's my kids being out of school and having just like general fun during the summer. Sorry, I forgot to pass it on. I don't know if this is the exact order. Carly Tate.
Hi everyone, my name is Carly Tate. I am a nurse in Frederick's Birth Center on the maternal fetal newborn unit. And I am most excited I have a ton of travels this summer, so just getting going to a different couple states, going to some weddings and just kind of seeing other parts of the US. And I'm going to popcorn it to, let me scroll down here, Claudia.
Hi, everyone. My name is Claudia Baristo. I'm an MD MPH student. I'm here representing Providers and Teens Communicating for Health, the Milwaukee site. And I'm really looking forward to planting my vegetable garden this summer. Heather?
Good afternoon, Heather Parody. I'm the medical director for the health department and a primary care pediatrician with Children's. I am most looking forward to evening walks. Let's see. Joanna O'Donnell.
Hi, everyone. I'm Joanna O'Donnell. I'm with Children's Health Alliance of Wisconsin. Specifically, couple of the projects I'm involved in are child death review and fetal and infant mortality review, offering technical support to those teams.
You muted. Didn't hear the last bit.
Was I muted that whole time?
You know, we
Just
heard
the end.
Yeah, we heard. what
Okay,
you said.
sorry.
Now,
I
what are
think
you
I
looking forward to?
tapped something. I'm looking forward to also planting my garden. I'm looking at it right now. There's a lot of work to be done. I will send it over to Annika.
Good afternoon, everybody. I'm Annika Moore. I am a public health strategist at the health department. Help if I take my post-it off. And I am kind of helping our team of strategists with MKE Elevate and work with our steering committee, also do some accreditation and some quality improvement work. Previously, I actually had worked with the FEMA program, so I'm also interested in this topic for a few different reasons. And I will pass it to Alex.
Hi everyone, my name is Alex Cohn and I help facilitate MKE Elevate with Annika. So I'm a public health strategist with the Milwaukee Health Department focusing on health equity. I am really looking forward to just being outside. I could lay by the pool for hours and read. The sun gives me life and I really appreciate that. So I'm going to pass it on to Tamara.
Peace, it's Tamara. I am Tamara Thompson. Oh gosh, and I forgot everything I was supposed to say. I'm a certified lactation counselor. I'm a doula. I'm a student midwife. I'm a childbirth educator. I wear many different hats between different organizations like Maroon Calabash, Wisconsin Doulas of Color Collective, the Wisconsin Guild of Midwives, and I recently took a position with DHS to act as the liaison for the newborn hearing screen program and the out-of-hospital birthing community. I am a houseplant person, so every window in this house is like crowded with houseplants, and I don't trust Wisconsin is done giving us frost. So when the smoke clears, I'm gonna have some room and the people in my family are gonna finally be satisfied and pleased with me that there aren't houseplants to trip over. So that's what I'm looking forward to, is putting all my houseplants outside so they can get some sunshine. I will pass it to Deanna Tharp.
Hello, I am Deanna Tharp, Director of Wisconsin Doulas of Color Collective. And I am most looking forward to traveling during this time. It is time to get outside, get some good vitamin D, get me a tan, and bring it on back into Wisconsin. So that's what I am excited about. And I will pass it over to Lakita Watts.
You know, I knew you were going to call me Deanna. I'm Lakita Watts. I'm a doula, student midwife, I should say full spectrum doula, student midwife, executive director of Essentially Empowered Inc., as well as a manager of TLC Community Health. And I am definitely looking forward to just the weather, but I have food on my mind and I don't know why. So I'm just going to say I'm looking forward to eating a lot of food. And I'll pass it to Teresina.
Hello, everyone. Teresina Simmons. I am founder of Regal Aspire LLC and Regal Family Services Incorporated, and also co-owner and manager of TLC Community Health. I am looking forward to actually going to the different parks and nature trails with my kids once the weather clears a little bit. We kind of started on the 80°/60° day, but we were fooled. So I'll hold off a little bit more. And I'll pass it to, I don't know who hasn't gone yet. Tracy Stanislavski.
Oh, thank you. I already went though.
I'll go so I don't have to try and remember who hasn't gone. I'm Benjamin Porter. I'm a program officer at the Greater Milwaukee Foundation. I oversee a health and health equity portfolio that includes dollars for healthy birth outcomes. I'm passionate about this issue. I think it's kind of the prime example of how we fail as a society. When you look at disparities in birth rates here and then compare them to other developed places, and just really want to see us do better. And I am looking forward to music this summer. I don't know if no one's mentioned Summerfest, so I feel like I'm going to be alone there, but I am amped for some good music. And I will pass it to my buddy, Robert Walker.
Thanks, Ben. This is Robert Walker. I'm a public health strategist at the City of Milwaukee Health Department. My focus is mental health and community resiliency. And I am also leading the Safety and Violence Prevention Action Team with the MKE Elevate. And so what I look forward to is barbecuing outside, grilling, also the water, anything with the water, swimming, water fights, balloon fights. Those are all things that I look forward to, and also traveling as well. So all right, I'll pass it to Jen.
Hi, my name's Jen. I'm a program assistant with the Milwaukee Health Department WIC program. The thing I'm looking forward to is gardening, especially the WIC gardens at all 3 health centers. I will go to, is it Elle Fitzgerald?
It's Ellie. Hi, I'm Ellie. I am a public health social worker with the Milwaukee Health Department. I work in the Empowering Families of Milwaukee program. I would say I'm probably looking forward to just like being by the lake and not being super cold, because it's still pretty cold down there right now. So once it gets a little warmer, a little later into summer, I love going to the beach and all that good stuff. Maricel.
Hi, thank you. My name is Maria Celeste Sandoval, but I go by Maricel because it's much shorter. I have worked at Planned Parenthood of Wisconsin for a little bit over 4 years as the bilingual community outreach and education coordinator. I am also the, I guess, manager or director of the youth volunteer program at Planned Parenthood called P2D, or Power to Determine Ambassadors. And what I kind of do is do more of expanding education and training on different sexual and reproductive health topics around the community and different organizations, and connecting them with different resources. Something I'm looking forward to. It's a lot that I'm looking forward to, but I think I'm just ready for all the festivals and events to happen in Milwaukee. There's so much going on. I feel like it's every year is even more. That and going to farmer markets. So yeah, and I'll go with Nicole.
Hi, I'm Nicole Matson. I'm an assistant professor at Marquette University in the College of Nursing. So I am a nurse originally, and I teach maternal, child, and pediatric nursing classes. And I also do research, and my area of research focuses on maternal impact or maternal infant diets that are impacted by substance use disorder. I guess what I'm looking forward to this summer is mainly just getting outside because I feel like I've been cooped up a ton, and I have a 16-month-old and a 12-year-old that both need to get outside. So we're going to get outside and get lots of sun. And I think I will go Jillian Smith.
Yes. Hi, my name is Jillian Smith. I am the Health and Nutrition Manager at the United Community Center Early Head Start and Head Start program. So we serve a lot of families on the south side of Milwaukee. I'm not necessarily here representing the United Community Center, just have a public health background and a huge interest in maternal child health. So I'm excited to be here. This summer, I think some people have kind of alluded to it, but I'm really excited for live music and music at the parks. That's one of my favorite things to do. And I was just looking, and I think I have like 4 different outdoor concerts that I want to attend in June. So I'm looking forward to that. And then I don't see anyone else's hands raised, so I don't know, has anyone been missed?
Anyone else on Zoom? If you haven't introduced yourself, hop on now.
Hi, it's Lori Dis, Director of Women's Services at Frederick Hospital. I have responsibility for our birth center and 3 ambulatory clinics, including our high-risk OB clinic. And for me, I'm most looking forward to hanging out by my pool if I can take an afternoon off.
And was that everyone on the Zoom?
I'll go. Hi, guys. I missed my name earlier. I do apologize. I'm Vanessa Johnson. I am a registered nurse in the community, a doula birth worker, as well as a yoga instructor, and the owner of A Miracle Happen Wellness and Birth Services, where I provided full spectrum perinatal services to expecting families, and the founder of Birth Workers United, which is a nonprofit organization with the goal of bridging the gaps between the emotional and medical models of perinatal care using a multidisciplinary approach. I know I was cued in early to talk about the Nurturing Collaborative by Dr. Greer, so I'll just briefly speak on that. We have a collaborative initiative that was launched in January with Feeding America, where we are serving over 200 expecting families through the end of the year and hopefully beyond, where we are offering amazing nourishment boxes, which are our food boxes curated by Dr. Greer, providing healthy fresh fruits and vegetables, recipes, lots of resources for food when it comes to food equity and bridging those gaps. We are also creating a village of support for these families where we host 5 workshops focusing on social determinants of health, ranging from healthy eating and nutrition during pregnancy and beyond. We have the doulas on board who are providing everything birth and beyond as far as education and support, facilitating movement workshops, pain management workshops, things of that nature. We are also bringing in mental health specialists to talk about, how to stay grounded and mentally well during their perinatal experience. We are also bringing in an amazing wellness provider, practitioner who is facilitating a self-care, self-love, sound bathing sessions with the families to really talk about like going inward and remembering yourself during this process. And then lastly, for the Nurturing Collaborative, we are also hosting community networking resources fairs in collaboration with those 5 workshops, where we are bringing and asking for all of our community partners who are passionate about reducing these birth outcomes and building this village to come on board and share your offerings with the families. Those repeat every quarter, so we just wrapped up our first 5. And then, also, one other piece is that we really were intentional about making sure that, again, the community involvement is strong. So we also offer what I'm calling nurturing boxes, where we wanted to provide tools for stress reduction, right? And so we know how that impacts the outcomes. And so we collaborated with over 10 women-led, predominantly Black and Brown owned businesses to sew into these families. So in these boxes, we have things like aromatherapy candles, bath bombs, bath salts, affirmation cards, reflection journals, all those type of things, again, to really just allow families to have those tools to go inward and ground and remember themselves along this process. And so I'm just happy to be here. This is my first time at one of your meetings and looking forward to get to know everyone and seeing where we can go with this.
you will have plenty to add to our activities brainstorming later on in this meeting. So I think that was everyone on the Zoom. I believe we had 2 or 3 more folks join here in the in-person room. If you want to do just a quick name, your organization, what you're looking forward to with the warm weather. Remember, our microphone is down on this end if you want to project.
I'm on Tyler Weber, and Deputy Commissioner of Environmental Health for the City of Milwaukee Health Department. And interested in just being outside as much as possible.
Nicole Logan with the Wisconsin Association for Perinatal Care, and I'm looking forward to working in my garden.
Good afternoon. My name is David Comer. I'm the supervisor of that project here in the Health Department. I'm looking forward to not taking my kids to school.
And I am Sarita Baumann from I Am Chronically Resilient. I am a chronic pain coach and wellness consultant, and I am looking forward to just being in the sun. I'm a big person. I love summertime, so let's just bring it. This needs to happen.
So that was everyone in the room now? Wonderful. That was, you know, I think that really reflected here in the Midwest. Once that weather gets warm, it's like we all come back to life, just like the flowers and the trees. We're like, people to see, things to do, being outside, you know, enjoying being outside instead of tolerating being outside. For folks, this goes for both in person and on the Zoom. If you have not gotten an email about this action team directly from me before today, feel free to put just real quick your name, organization, email address in the chat. At the end of the table there, we've got a sign-in sheet that I believe most of you have already seen and filled in. That way I can make sure to get all of you guys on the email list, so you will be sure to get all of my communications going forward, including the follow-up email that I will send next week after this meeting. And so that is really close. I almost can't see that, it's so close. We did go over on our agenda a little bit, but hopefully I built in enough padding and we'll be able to go nice and quick through some of this other stuff. So just a very quick overview on what MKE Elevate is. That is the name that we have given to our 5-year strategic plan or community health improvement plan. So if you hear CHIP at all, that is the same as MKE Elevate. The goal is to find alignment among MHD programs and all of your organizations in Milwaukee that are already working on maternal and child health, so we can see what each other are doing, make sure we're all traveling in the same direction, boosting each other where possible, and just really finding each other to maximize all of our collective work. And so the selection of the maternal child health priorities that we're going to get to in just a moment were done with community surveys during the summer of 2022, and as well as some internal MHD discussion just to put a little finer point on some of them. So that's where we got the 4 large buckets of goals that we're going to talk about. And then to further develop those goals, because they were just kind of broad buckets, we had discussion in the February action team meeting that many of you were at, but also some new faces. So now we are going to make sure that we are all in agreement with the language that we have selected for those goals. So just a little bit more on MKE Elevate on the right side of the screen. This is also on our website. This is just a timeline of our activities. So you can see when those other meetings happened. Our steering committee, they met in February. They gave some initial feedback on the goal language that we got out of that February action team meeting. And they're also working on a draft vision and mission statement. And so we're also working on creating some infrastructure groups. Those will be, you know, there will be a communications one, a data one, I think a third one, policy, so that we can have opportunity to bring people from across the various action teams to work on these other skill development, networking, support. If your organization needs support in those areas, we can do that too. And so on this timeline, we're at about number 5, the Q2 meetings there. And Go ahead, Amanda. Thank you. So now those draft goals, like I was saying, our main goal for this meeting is to come to an agreement on the language of these goals, mostly for the purpose of the CHIP report. It's not going to be, you know, carved in stone, never to be changed again in the coming 5 years, but we want these to be, you know, broad enough to encompass all of our, you know, changing, ebbing, flowing activities, while still being focused enough that we know we're all traveling in the same direction. So we are using kind of the Smarty Goal format. So again, the draft language was used with action team contribution from the February meeting. And metrics were informed by what MHD, what our data and evaluation team already has access to. If your organization has additional data sources, or if you think you have metrics that would be applicable to any of our goals or strategies, we would really welcome that data as part of our collaboration. And so just a reminder, if anyone has previously learned the kind of Smarty format for goals, we want to try to get these to be specific towards what we want to achieve, measurable. So there should be able to, you know, attach a metric to it. Achievable and realistic kind of go together. We want this to be challenging, but still possible, still realistic given our collective capacity. Time bound, we do have a, you know, this is a 5-year cycle, so we're going to be looking in that time frame. And then the IE at the end of Smarty is for inclusive and equitable. So we really want to make sure we are keeping that inclusivity lens on things and the health equity with a justice focus on these goals, particularly in terms of, is there anything we can do to address systems in any of these goals? So remember, we are trying to find consensus. So the first goal bucket was healthy birth outcomes. From conversation, we landed on this top language here: improve birth and health outcomes in Milwaukee, especially for Black babies and pregnant people. A couple of possible metrics there. I know if anyone on the Zoom has young ones, you know, this is maternal child health. If they wind up on screen, I don't think anyone can possibly be upset about that. Absolutely don't worry about it. So these are just a couple of potential metrics. We've got infant mortality, 9 per 1,000 live births in the city of Milwaukee, but only 5.9 statewide. Premature births is at 11% in Milwaukee, but only 7.3% statewide. We could look at potentially C-section rates, racial disparities between these different metrics. And then we could look at things, again, pending data sources, access to doulas, access to other care providers, access to breastfeeding consultants, or additional supportive care. So improve birth and health outcomes in Milwaukee, especially for Black babies and pregnant people. Is there any objection? Feel free to raise a hand if you're on the Zoom, or just come off mute if you would like. If there is not an objection, we'll say we have consensus. Karen?
Hi, Ms. Akinel-Feltman, one comment. We've been using Perry data from one system right now. We have from 2008 to 2019, about 90,000 rows, and we're working on getting more Perry data from other health systems. We've been working on analysis and did indeed find the data that you have too. We have it in the Perry data for Milwaukee region, but we also found these poor outcomes for the Native American populations as well. And so I would like to add, or could we modify it to also include other groups that might have similar problems?
Could we say especially for BIPOC babies and pregnant people?
Yeah, that would be appropriate because we see the trend unfortunately heading in the wrong direction for Hispanic as well. So yeah.
Just to make sure we're using consistent language. Yeah. I am familiar with BIPOC meaning Black, Indigenous, and people of color, to be inclusive of all non-white folks. I have also seen it as meaning people of color who are Black and Indigenous a little more exclusively. I would lean towards the first one with that broader umbrella of all people of color. Are we in agreement there? Anyone would like to raise a hand for the comments? I will be taking these notes to make sure the language change is noted, especially for BIPOC babies and pregnant people. And if we are all good.
And I just want to know the metrics to make sure you separate the metrics.
Absolutely. These are, for the sake of keeping it all on one slide, these are only the highest level metrics. We will certainly be going more in depth in the actual report.
I don't want to slow things up, but did you look at maternal mortality, or was that discussed with this goal, or is that?
Interestingly, that didn't necessarily, well, again, those surveys, it was nearly 3,000 surveys or just over 2,000 last summer.
It was over 2,000.
Over 2,000 surveys last summer. Maternal mortality specifically didn't necessarily rise to the top. But again, this is meant to be an umbrella goal so that birth and health outcomes for the babies and the birthing people, when we get further down, we'll be able to have a specific objective to address maternal mortality.
And then on the Zoom, we have Teresina.
Yes, Teresina, thank you. Go ahead.
I guess the one thing that I'm seeing on here, well, that I'm not seeing, if we can find a way to like identify like that first contact for prenatal care, because that directly impacts, you know, some of those birth outcomes.
That's going to be on the next one.
Okay.
And then Tracy also.
Tracy, yes.
So I wasn't involved in the first meeting, and maybe this falls under a different category, but I'm wondering about when you're talking about premature births, you're also looking at potentially children with significant health issues, disabilities and things like that. And so I don't know if that's tracked somewhere and their access to some of those programs that serve those children. So Birth to 3, in our case, teachers of the visually impaired, sensory disabilities, things like that.
That is, we can certainly talk with our data team. They have access to more data sources than I really know about, so we can certainly see how deep that data goes. Then with that language being Teresina, yeah? Was your hand still up or did you raise it again?
Oh, no, I'm sorry, I'll put it down.
Okay. All right, we will go to goal number 2.
Melissa?
Yeah.
I just want to, Benjamin put in the chat, I like keeping Black separate, given the role of anti-Blackness in these disparities, maybe spell out BIPOC. I just want to make sure that comment wasn't missed.
Should that be in this goal language, or would that be something that we can include in the language of our report? I know there's, like you said, this is a very nuanced thing, so we could say Black and POC, keeping BIPOC keeps that I for the Indigenous folks. We can keep it BIPOC where we want brevity a little bit, and then certainly I think we could spell that out when we're doing full draft language. I'm a fan of pop-out boxes where you take a little space on the side of the page to fully explain a concept, because this is a newer one for some folks. There are plenty of people who don't know what BIPOC means at all, and so I certainly like to take that opportunity to explain why it's framed this way. So yes, we will make sure that that gets explained.
Hi, this is Tamara. Sorry, I tried to raise my hand and then I accidentally lowered it. But on goal number 1 at the very bottom, would it be something we could discuss for adding midwives as well? At the bottom, it says access to doulas, breastfeeding consultants, and other supportive care. And I wanted to talk about adding midwifery to that one.
Yep. Again, these metrics are just to show a few examples. We're going to get to the brainstorming section in a little bit, and you will be able to put every type of metric that you would like to see. There will be space for that.
Okay,
yeah,
sorry.
No, it's all good. That's certainly something I could have explained when I opened this slide at first. So we've got our language for goal 1 there. Goal 2, the bucket was reproductive health care. And so the language we came up with is Improve access to high quality and culturally competent pregnancy-related healthcare. And so this is where those more direct healthcare related metrics can come in. For example, the access to early prenatal care, which is much lower in Milwaukee compared to the rest of the state. This is where we could start to find diversity of the pregnancy related care providers and other metrics along that thread. So Tams, I see your hand up again. Go ahead.
Sorry about that. I forgot to lower it. I am having thoughts about that, but I think what you're saying is that we're going to discuss things later on in the end. So I'll just hold on to my thoughts.
Yes, remember, these are the umbrella goals. And if you have something more specific, we will have space for, objectives of how we get to the goals and things like that.
I just offer one wordsmith. So instead of culturally competent, thinking about culturally affirming or culturally humble. I don't know if anybody.
We had lots of discussion around culturally informed, a variety of ways. So if other suggestions, absolutely welcome at this point. We thought about this one, and I'm glad to hear more.
Yeah, I've heard culturally curious.
Culturally curious?
Because competence implies that you know everything about a culture. And so it's culturally curious, culturally open, culturally informed, but competent means you know everything.
Sure.
I'm a nurse and I recently graduated from UW Milwaukee, and they're a large nursing school in the area, and they commonly use cultural humility over cultural competence for a similar reason.
I've heard that one too.
Sure. And we've got in the chat culturally reverent or culturally decolonized.
Maybe we can collect all of these suggestions and send it out for a vote.
This is something I will be doing a feedback survey at the end, so I can try to remember to include a question about, vote on this word here. We spent time thinking about this one while we were drafting these goals, and we recognize that, we internally can't necessarily make this decision. And so I'm very glad that this conversation is happening. Yep, we thought about culturally responsive as well, culturally matched.
Culturally sensitive.
Culturally sensitive. We can also think about, as we are working on this, is Milwaukee and Milwaukee-based practitioners, are we at a starting point with this? So there's, a long road to go, or are we at a point where maybe we can push the envelope a little bit with, language around potentially decolonized or something like that? So that might be another way to kind of think about this, how far down that path are we?
Depends on your audience, who's reading these goals.
That's true. Different receptivity from different folks. Culturally appropriate is another one. And yes, the metrics will be much more specific in the actual report. So I think some top ones, I think cultural humility was suggested by many folks. Culturally sensitive was another one, just to think about some of these ones that really came to the top. Karen, are you taking some notes on?
Yeah.
Got note takers, so I will be bringing this to you guys in the feedback survey. Samaya, what's up?
Hey, I was thinking it might be helpful because if you think about these terms, you could almost think of them as being on a spectrum, like culturally appropriate, competent, there's different levels. And so it might be helpful if you were going to send out to have definitions of things, because I think people are sharing stuff that they have been, maybe they've been accustomed to using in their own respective spaces, but it doesn't mean that it's something that we would want to collectively agree on, because all of our institutions or spaces are at different levels of implementation related to equity work, right? So it might be helpful just to say, here are some options, here are some loose definitions of them, so at least we can have shared language, because I think I don't know that just sending out a list will really get us anywhere. Aside, if we don't have definitions, but that's like a whole exercise within itself. So would it be maybe even helpful to just like collect, I'm sure there's like lots of words that folks are going to have feelings about, maybe like collect that list of words, and then we can figure out like what the best language is to describe different things. And then we can, have some agreed upon language as an activity.
One that I thought of is culturally respectful.
Culturally respectful. And then in the chat from Erica, should the verbiage reflect active learning and application? If we can find one that gets both halves of that. This is plenty to think about. I've highlighted the word competent. I kind of figured that this one would generate discussion. And so I will certainly work on finding the best way to send it back out to you guys for how to continue working on this, because this one, we thought about this a lot. We knew that this was gonna matter. This is the most important word in the sentence, I think. And so we'll work on what captures the accountability, the learning, the progression, and the significance here. So aside from the word competent, the rest of the goal, is that looking good?
So the only one other comment, maybe didn't bubble up in your assessment, but just thinking about linguistics and language, and maybe that's encapsulated in cultural, but having providers, well, I know we see issues with our population not having providers who can appropriately speak their languages or access to interpretation. So I don't know if that was in there, but usually you see culturally linguistic together, and so that's why.
Got it. All right. Thank you for that conversation. We'll go to number 3. The overall bucket for number 3 was nutrition. And so we came up with promote use and expansion of family nutrition programs and encourage uptake among eligible people. So some of this was because some folks said that they had heard about WIC and other such programs being underutilized, folks not even realizing that they are eligible. So that's the promote use and expansion of those programs, and then encourage uptake. So really promoting who is eligible, getting that word out there. And then metrics, we may see if we can get metrics from our WIC program. PRAMS has a couple of questions regarding food insecurity for before, during, and after a pregnancy, which could be informative. We're just still working on getting access to the PRAMS data at this point.
The Perry data also has a variable on WIC. And
that would be great. Yeah, we would welcome more data sources.
We just had a student analyzing it. It's about 60% use WIC.
Okay.
Of the sample patient population that we use, that we looked at. So that probably is a good measure to include.
When I read that, that does not really resonate with me for those family nutrition programs. Pain makes me think, what are you talking about? So, I think you should be more specific if you're going to talk about safety net programs or that, because it doesn't really get me to the nutrition programs. It doesn't really get you to I just think you need to be more specific.
Yeah,
That's what you're going to be looking at.
This was us trying to find that line between general, food programs that might not be hyper focused on pregnant people or families, but still, specific. So
Yeah,
what was it,
usually what
food
they
safety
call it,
net programs?
that's what you call it, food safety net programs. All different types of programs. School meals and all sorts of.
I think that was just language that eluded me while we were working on these. I'm happy with food safety net programs.
I
That,
have a follow-up question. So if we used food safety net programs, do we feel like I'm forgetting the name, but your daughter's program?
Oh,
Would that be included in that, or does that feel, because food safety net to me feels like government based? So would that be inclusive of programs like that?
It can be, the food safety net programs can also be things like, your food pantries and things like that. So, the safety net, government uses that a lot, but it doesn't encompass, both governmental and non-governmental sources.
yeah, and so just knowing that there are organizations like yours doing these things that aren't necessarily, like she was just saying, that's kind of the balance that we were finding. But once we get to the brainstorming part, you'll be able to see how and where your organization fits in on those.
We also do agriculture programs in the non.
So including education and access from the chat. All right. We're good. We'll go to number 4. The broad bucket was maternal mental health. The discussion in the February meeting remained a bit vague around this one. So I tried to kind of pull things together into some goal language. So improve access to resources for maternal mental health and caregiver support. And that is separate at the end because folks specifically said that it is not just mothers and birthing people who are caregivers. We've got grandmas, grandpas, aunties and uncles, godparents, your family friends, all caregivers. So we wanted to be inclusive of anyone who is providing care.
Do you want to add qualifiers again? Because I mean, access is one thing, but what about high quality and culturally affirming, access to high quality, culturally affirming resources for maternal mental health and caregiver support?
So pretty much utilizing that same language
Just
from
a
the
thought.
reproductive health one, bring
Yeah.
it into mental health as one. That makes sense.
Maybe caregivers and social support networks.
And then there was a comment in the chat, what about infant mental health? And I think Sumaya has another comment as well.
Yeah, so I saw the infant mental health comment first. Tamara, do you have any thoughts on how you might add that into this goal?
I'm not sure. It's just one of the things that I think about often as new parents are deciding how they will raise their children, and the awareness that it starts in infancy, and thinking about infant mental health and education for parents who would benefit from having some sort of education on infant mental health and awareness of their own ability to support and nurture and enhance their infant's mental health. I just don't know how to word it, but I just thought it would be important to include.
Sure, and that can certainly still be one of our objectives or another strategy that we put once we get into the brainstorming area. Maya?
Hey, I was just wondering, are we separating mental health from behavioral health? Would it be both mental and behavioral health, or is the priority? I'm just wondering, was that intentionally not included?
I think mental health is just how the survey was phrased last summer. If behavioral health is the more inclusive of broader services, I'm fine to switch that if other folks are good with that too. I think that's just some of the specifics that myself and those of us drafting these goals maybe are just aware of the particulars of that language, but I'm happy to switch that to behavioral health.
Well, I think I'm kind of saying an and instead of an or.
That is an
And
and.
it even, I think, Nicole's comment, like looking at substance use disorder and some other things, I would envelop in the behavioral health component.
Absolutely.
My understanding of behavioral health has mental health and substance use in it, so that's how I think of it. That it's a broader umbrella, but others may think differently, so that might be another one of the definitions, but.
Remember, we'll have
Makes sense to me.
multiple strategies within each of these goals. So it's not solely this thing. This is the encompassing goal where we'll be able to have, services, substance misuse area, we'll be able to list those more specific things.
And I'm looking at the idea that it's so easy to knowledge of health.
Was that your hand?
I'm glad that substance use came up because granted it's statewide, but the county level data that up the state reports for the and they released a report last year saying that half of the pregnant and postpartum people that are dying from overdose, and that's driving quality collaborative to work on care for pregnant. That might be another possible metric. Under the SED portion, but
certainly
there's
those.
tons of evidence to say mental health and SED are like they're locked in each other. So those might be some other metrics available.
Tracy, I think your hand was up first.
Yeah, just kind of going along with the comment in the chat. I agree that mental health can be considered wellness and well-being versus like there's a problem with your mental health as far as mental illness. And I think that's an important distinction that should be included in this as well.
I just saw that chat. Thank you. And Teresina?
Okay. I guess I just had a question about, I know resources, that seems pretty broad. When I think of resources, I think of like the support groups and maybe things like that. Should there be a distinction between resources and providers? Like access, like to resources and providers, because that's where a part of that timeliness comes in. With the access to actual providers that are able to dispense medication, like do other things, higher level things with mental health support.
Sure. I think part of that particular aspect while we were working on this is, and folks who have more knowledge on the landscape, please correct me if I'm wrong. The county currently has not a ton of capacity amongst mental and behavioral health providers. Folks not taking on new patients or clients. It's hard to get in places, which is part of the problem. But again, just keeping that SMARTY framework, what is within our capacity to impact. So none of us in the room or on the Zoom right now maybe have the capability of hiring more therapists, but do we have the ability to promote the resources that are much more easily accessible? So that's where we kind of did focus on resources rather than specifically on therapy or that type of care. So we were just trying to keep in mind what's feasible in 5 years for our team. So if there are more questions knowing that background.
You think that there's no metrics and just something can be put in the metrics that specifically is more for,
We definitely bounced that idea around. We don't know exactly what kind of metrics that are. So one of these poster boards here, as well as online, you will be able to brainstorm metrics. So if you know of a metric that would talk about, number of providers, easily accessible providers, things like that. If you have access to the metric or you just know how to phrase it for where we should look, please, by all means, please give us that information. So I definitely have that feedback on these goals. Again, I'll be making the changes that I can change and then creating some kind of survey or something to send out regarding what we are still in the process of discussing. That'll go out in the follow-up email. And so we will go on. We maybe don't have as much time as I would have liked for the objectives, strategies, and partners, but fortunately with this, I can leave you access to the collaborative portion so you can keep brainstorming after this meeting. The objectives, those are the various things that are going to lead us towards the goal. The strategies are what we're doing, and then the partners is the who, and then metrics is just kind of, you know, over the top or along the side of all of these things. And so this is where we're going to start defining these more specific things. So you know how it's the goal language before wasn't quite as specific as we liked. This is where I want you guys to dig in, get specific about, you know, what you would like to see achieved and how we can achieve it. Amanda, if you want to go to the next one.
Yes, sorry, I was just getting
You're
the
fine.
link ready to post.
This is just to show you guys how we're going to organize things in our report. So, you know, we've got objectives are going to go in the column on the left there. Our strategies, you know, we'll add more rows for if it's multiple strategies per objective, and then our partners will be paired right there. So this is just kind of the tool we've been using to organize these thoughts. And if you go one more, it is just an example. Again, the things you see here are what me and the MKE Elevate team brainstormed. Absolutely none of this is set in stone. If you say it's wrong, feel free to leave a sticky note saying this is wrong. If you have additions, you can add it. This is just kind of to seed the discussion for all of you so that you can kind of see what it looks like filled in a little bit more. So if you want to go one more. The folks on Zoom, we have a Jamboard that is a Google tool, and it's going to open a new link. If you click the link, that has sticky notes on it. So it's going to be organized with objectives, strategies, partners. You'll be able to click on the little online post-it notes, type it in there. You'll be able to move them around. And then at the very top, there are some arrows that you use to scroll, and it'll take you through these different goals. Each one has its own boards. In person, we have the analog version. We have paper and sticky notes. More sticky notes and pens are here in the boxes. We can get those spread out. Please make sure to include your own organization's efforts on these different goals. So, you know, if you've got a program, if you've got a resource, whatever it might be, feel free to list yourself as a partner, and your effort can be under the strategy, you know, working towards whatever objective you want to do there. So ongoing efforts are the main point of this. So we want to see what is already going on. Oh yeah, if you want to go one more, Amanda. Just a couple questions to keep in mind while we're brainstorming. So again, thinking in that SMARTY format, you know, the achievable, realistic, just making sure to keep those in mind. For strategies, really think about if it's an activity or an outcome. So is it actually something you're doing, or would it be a metric instead? Think about, you know, just make sure the causal pathway is there. Activity A leads to B, B leads to C in the metrics, you know, that kind of thing. Just to make sure that we're not going down sideways paths or losing track of what we're working towards. And again, clarifying things, you can do quick jot down on stuff, but the more information you can provide, the more concrete each of these can be, the better. I really thought I already gave the Jamboard permission to edit. Oh, let's see. Yeah, it's already set to anyone with the link.
Can you get me a new, yeah. And then can you just pop a new link in that document?
I can just
okay.
Chat. All right, new Jamboard link coming on, you guys. Hopefully that one should let you see and edit. Also online, try to avoid deleting others' notes. I realize you don't know when someone's going to click on the sticky note you're hovering on. If you look at that toolbar on the left, you'll see a little white square with the corner folded up. That is how you add more sticky notes. So if you run out, please feel free to add more.
I'm sorry, we should be working on a new blank one or on the ones that are already developed?
The ones that are filled up is solely our initial brainstorms. So again, that is the first ideas that we came up with, just as the MKE Elevate team. So you can add notes to those, you can duplicate it, you can refine it. And then if you click after each goal, there is blank space for if you need more. So those are just to start the brainstorming process.
Okay, thank you very much.
Melissa, did you want me to put everyone in like a randomized breakout groups, or how did you want to do that on the Zoom end?
We'll just have you guys all stay together just since we're running a little bit short on time. So everyone really use this time to get into that Jamboard, add things, and then in a couple minutes, I will call us back and we can kind of see if we've got any feedback. Double click on those Post-it notes and it'll pop up on your screen for typing.
And we are still here to answer any questions that come up.
Yes, I turned my video off just so that I can walk about the room.
Is there any additional context on the form of prevention that around the?
Hang on one second. Let me fix this.
Maybe, you know, put in line your things just so I know what's
All
next
right.
to what. That would be
All right. Can you repeat that question?
Yeah, I need to learn about it.
Intended here.
Just got another discipline. When you work. Yeah, very cool. I'm all about this. Sounds good.
Melissa.
Yeah. Well, we're both the college. Okay.
For the third objective, can you just pop around? I wanted to know if there's more context for the form of prevention that's intended here.
honestly not really. Again, it was very vague.
Yeah.
We're sharing some headphones here, so hopefully you guys can hear me. The prevention in that objective, that came out of the February discussion and it was left fairly vague. So I didn't want to expand or try to steer it in any direction. So that is wide open. If you've got ideas, go for it. If you don't think it's appropriate, feel free to say we shouldn't do this. It's this is a wide open brainstorm for everything.
I'm wearing it.
Oh, sorry, you've been, are you unmuted?
I was trying to use that one.
Okay, no, I've been muted, so
You've been
restart,
muted,
yeah.
okay.
Sorry, everyone.
Now, Zoom folks. Hello, are you guys still there? Thank you for coming back on video. I appreciate that. We are just going to do a couple of hopefully quick wrap ups. So if you want to go to the next one, just as a little side note, policy advocacy can count as one of those strategies. And so we've got some federal legislation with the Black Maternal Health Momnibus Act that was brought by, I now see I misspelled Senator Tammy Baldwin's last name and Congresswoman Gwen Moore. They are both in the group across both chambers of Congress pushing this act of 13 bills in this package to address the maternal health crisis, particularly focusing on Black mothers and babies. Baldwin and Moore specifically introduced the Perinatal Workforce Act, which really gets at some of the, having providers who are representative of their population, as well as having a diversity of types of providers outside of just an OBGYN, bringing those midwives, doulas, other practitioners. So that act in particular really falls in line with some of our goals there. So if you're an organization who has legislative advocacy as within your scope, this would certainly be something to push for. You want to go to the next one? I want to give just a quick little overview about what it would mean to be an implementation partner on one of these. So if your organization is doing something that's in alignment with what we're doing here and you agree to sign up as an implementation partner, that just means that you're agreeing to collaborate with the Milwaukee Health Department to support that implementation and work towards the plan's strategies and initiatives. That includes providing expertise. It could include things like data sharing as it relates to the goals. So if you've got any of those metrics, sharing that with us. Next one. And then additionally, what you would be agreeing to, again, just sharing that program data. So if you have grant funding that you report data on, it would fall under that. Or if you have other reasons that you collect and report on data. Note, if your organization doesn't have an established data reporting process, or if your capacity to analyze data isn't quite there, as part of the CHIP here, we do have a data team that can work with you to start to work through your data processes there. Another part of the agreement is attending at least half of the action team meetings. So that would be 2 out of the 4 per year, and a general meeting, which would be 1 per year. And then a commitment to being an anti-racist organization. So we do have addressing racism and health equity as the CHIP's big, broad, overarching goal that covers all of our action teams. And so we would appreciate if our partner organizations can sign up on that. And this is just to give you guys an overview. Nobody is signing a contract right now. I will be sending more information out in the follow-up email. I just wanted to let you guys know ahead of time a little bit. We want to go to the next one. So as an action team, we would have our next steps of things like deciding how frequently we want communication, what we want that communication to look like, what we want it to include. I've been sending updates sort of on a monthly basis, but also sort of if there's updates to share, I just kind of send it out so we can come to, down the line, we'll come on a group agreement about what we want that to be. What we want the action team to do, how we want to function. Do we want to have subcommittees? Do we want to stay as one big group? This is all stuff that those are the next decisions that are going to be coming down the line. And so there will be a survey just to start gathering some feedback on those types of things in the follow-up after this meeting. And so I had a community member very helpfully remind me that we were considering compensation for those of you who are attending outside the scope of your paid work. So for those of you who are not being paid for your time to attend this meeting, we have $50 Visa gift cards. Again, your follow-up email is going to have that information. So you'll be able to provide your name and info to me. We will get that mailed out to you. I've been talking about co-chairs for a while. This is the last push because we're gonna vote at the August meeting. So if you are at all interested in being a co-chair, send me your information, tell me you're interested. Don't worry about not having experience. I don't have experience, but here I am as the chair. So go ahead and come join me. I would love it. And then I'm going to do a little boost for my other project, which is FEMUR, the Fetal and Infant Mortality Review. We are exploring and planning to start a community-based action-oriented team. We're still in the very early planning stages of that, but we want to bring FEMUR into the action side of things. There's obviously a lot of overlap with this team, particularly healthy birth outcomes, that first goal that we were talking about. So this is something where if we decide to do work groups, I may lean on that work group to come into that FEMUR world a little bit. There's still a lot of ways it could look, but I just wanted to put it out there to everyone that these groups are going to be talking, if not overlapping, in this very important work. One more slide, just to tell you about the next upcoming meetings, June 22nd. Same time frame, 4 to 5:30. We are going to have our general meeting, our community MKE Elevate meeting for all of the action teams to come together, networking, catching up, learning what they're doing. There's a lot of overlap with the MCH world and the other action teams. If you have your phone, you want to point your camera at that little QR code. Otherwise, I will send out the link in the follow-up email as well. I want to make sure to promote there will be delectable food and mocktails. Should be a good time. More opportunity to network, which I know we all love. The next action team meetings for all the teams going to be August. Again, you will be getting information ahead of those dates. One more slide, Amanda. Woo-hoo. We did it. Thank you so much, everyone. I was not expecting nearly 40 people between the Zoom and the in-person to be here. Really terrific. Thank you so much. That Jamboard is going to stay open. You will all be able to continue providing feedback if you think of things down the line. I'm going to put everything that I rushed through in that follow-up email. That's going to be going out early next week. So thank you for sticking it out with me in the last few minutes there.
Thank you.
Fun.
Your first hybrid meeting. Well done.
It was pretty smooth.
It was very nice.
Let us know if you have any feedback about getting this to the hybrid
Yes.
to work better too.
Hybrid feedback.
We appreciated
Very
that.
appreciated.
I think it was crucial to have you helping out. Yeah, like I just like you need a person.
Yes, actually, if you